So what I want to talk about now is the antibacterial and antifungal properties of sulfur. How is sulfur being used when you take it orally? How is it being used to combat overgrowth of bacteria, to combat overgrowth of fungal species that may be inhabiting your small intestine and fermenting your food and causing gas, bloating, irritation, inflammation? And the nice thing about using a food-based or a natural or a plant-based substance is that our bodies already have an understanding of what that is. And I'm saying that because if you take an antibiotic, that's not something that our body recognizes as, oh yeah, I've eaten this before, had this before, I know how to interact with it. And so it's very powerful. And things like Xifaxan or rifaximin, when they're used to treat an overgrowth of bacteria within our digestive system, they're going to kill more than, it's a broad spectrum, they're going to kill more than just the fermenting organism, the gas-producing organism that you're after. And yes, there have been some studies that show that they don't have a large impact on the Lactobacillus or Bifidobacter species, which is great. However, we have 700 different species in our system. Lactobacillus and Bifidobacter are only two of them. We know that sulfur is an antifungal or an anti-yeast product, and at least in this case, this product has been around since 1926. It's used in farming. It's the only safe fungicide that's used in organic farming, and it's the oldest known fungal pesticide. It can be used even up to the day of harvest, again, because sulfur is something that our bodies recognize as part of a nutrient component. And there's even some plant species that have this induced topical antifungal sulfur defense, so that when the plant is aware that there's molds in the area, molds are fungus, yeasts are also in the fungal category. It's a big category. So when the plant detects that, it releases sulfur on the top of its leaves to prevent the mold growth on top of the plant. And we know that sulfur kills fungi on contact. And it's not 100% understood how it does that, but what's believed is that the sulfur reacts with the fungal species that produces a toxic agent, and then that toxic agent will go into the fungal cells and affect cellular respiration. That's how it breathes, is a loose way of saying it. Cellular respiration is a little bit different than respiration in a human lung, but essentially it stops it from breathing. That kills it. We also know that in farming, at least, sulfur is registered with the Environmental Protection Agency for use as an insecticide, a fungicide, and a rodenticide on food and on feed crops, in ornamental turf, and also in residential sites. And sulfur can also act to reclaim the alkalinity of the soils if that's necessary. In this study, what was done was different forms of sulfur were taken to see what concentration was most effective at killing 4 different microorganisms. Now, microorganisms can be bacteria or yeast. So in this case, they were looking at Staph aureus and E. coli, which are 2 bacteria. And they're also looking at Aspergillus and Candida. Aspergillus and Candida are both in the mold category. Aspergillus is a mold, Candida is a yeast. So what they did is, here's the pictures over here. You've got Staph aureus, you've got Aspergillus, you've got E. coli. That's the nasty one that causes, diarrhea that puts you in the hospital. And then you've got Candida albicans, the yeast. So what they did was they took different concentrations of these different forms of sulfur, so elemental sulfur, sodium thiosulfate, sodium metabisulfate, and sulfur nanoparticles. Now, the most effective ones at killing all 4 of these different microorganisms were the sulfur nanoparticles and then the elemental sulfur. They were very effective as you went up in concentration. And if you look at these graphs here, what you're seeing is that with increased concentration over here, you've got decreased growth of the different organisms. So just follow that line down. It goes down here. These 2 go down. These go down together, and these go down. So going down means it's killing it, staying up means it doesn't. So the sodium nanoparticles and the elemental sulfur were both effective on all 4 of these species if you increase the concentration, and you see the time to kill. The antibacterial and antifungal properties, now this goes back into some of our wisdom, right? The wisdom that we had before we had a lot of pharmaceutical medicines, before we had antibiotics. In this case, people would go to the sulfur springs around the world and mineral springs, and they would drink the water. And they would drink the water because that water they knew had, that sulfur nanoparticles in the water, could damage the microorganisms' membranes, so bacterial membranes, and cause cell death. Now, we didn't know the science behind it, but we knew that it had an effect, right? So intestinal antimicrobial properties of MSM, or methylsulfonomethane, which is a naturally occurring organosulfur compound, it forms disulfide bonds with the free sulfhydryl groups of the bacterial membrane, and that's what just damages the bacterial membrane to kill it. We know that organosulfur compounds exhibit a wide range of antibacterial properties in addition to killing the bacteria itself. So that's the nice thing again about plant medicine and about natural medicine, is that it doesn't just do one thing. If you have an antibiotic like against Xifaxan, and it's going to target one specific mechanism on the bacteria that's going to kill it. It's going to remove a certain protein or remove a certain element to actually damage the microorganism so it can no longer live. In the case of natural substances, they do many things. So these organosulfur compounds, in addition to being bactericidal, are also antibiofilms. So they stop the formation of that protective biofilm that the bacteria put around them so that they can hide from your immune system. They're also antitoxin, and they're anti-quorum sensing, meaning they stop those bacteria from grouping together and making a stronger community that is able to overpower your immune system. So again, it does a lot of different things, not just one particular thing. And again, going back to the idea of the mineral springs, that we know that sulfur has been recognized throughout history as an antibacterial agent. It's been given orally, that's drinking the sulfur waters, for bacterial infections, and used topically as a fungicide and a bactericide in the treatment of cutaneous infections. That's dermatology, skin disorders. So if you look directly at skin disorders, we know that sulfur is antifungal, antibacterial, and karyolytic, meaning it can break down the keratin that's blocking the pores and causing things like acne, as well as block the attachment of a bacteria to the host, which stops it from causing an infection or something that leads to acne. Sulfur has other functions as well. It doesn't stop there. So sulfur is really, really important in our body for many things. And later on, when I'm going to start talking about the work of Dr. Stephanie Seneff and the sulfur deficiency issues that we have currently based on pesticide use, you'll see how these things kind of tie together in terms of other problems you can have if there's a deficiency of sulfur coming into the body. So one of the things that sulfur does is it transports cyclic compounds. Cyclic compounds are the ring structures, and those cannot be transported through the blood without sulfur attached to them. So sulfur or sulfate is attached to vitamin D, cholesterol, tryptophan, anything that has a ring structure, tyrosine, and that allows it to move through the blood to go wherever it needs to go. Now, Dr. Stephanie Seneff believes that a lot of our cholesterol problems are based on the fact that we don't have enough sulfur, and the cholesterol, instead of being transported through like it's supposed to, will stick to the walls of the arteries and block those walls of the arteries and cause things like strokes and heart attacks. So that's an interesting concept, and I have a lot of patients on the sulfur treatment, obviously, and it'll be interesting to see if that impacts their cholesterol levels as well over time, and their any kind of blockages that we're trying to prevent with aging. On the other end of the scale, sulfur is used as a detox. So phase 2 sulfonation is one of the pathways that the liver uses to, again, sulfate something that it's trying to get rid of. Stick a sulfate on it, make it water soluble, send it out through the bile and into the digestive system, where it can then exit with your waste. Sulfur is also important for DNA repair as an antioxidant. And then this fourth item on the list here is really fascinating, hot off the press. There's a research scientist at the University of Washington who's a bioengineer, and what he's found is that there's a fourth phase of water. So let's go through the three other phases that we know: liquid, water, solid, ice, steam, gaseous. Those are the three phases of water that we know. He's discovered a fourth phase of water, which is a sulfated water, which forms a gel. And that gel protects our blood vessels, and it also protects all of the molecules that are suspended in blood. So everything has this cloud of sulfated gel water around it, protecting it. Now, that's not something that people are talking about, because this is something very new that he has discovered. And again, that could also be potentially could be one of the problems with the ubiquitous nature of cardiovascular disease or heart attacks and strokes in the aging population, a sulfur deficiency. The next thing we're going to talk about is cases. So I'm going to go through some of the cases that I've seen over the years, just picking out a handful. There's so many, and talk to you about the response that I've gotten with people, and maybe some of the intricacies that we've had to work through, because not everyone is a one and done. It happens a lot where, someone has either found the GI Janelle 1 powder and started using it before I talked to them, and they're already starting to get some good resolution of their gas, bloating, abdominal pain. But that's not always the case. Sometimes I have to work out some of the intricacies to get someone to a place of health and get rid of their symptoms.